It's very traumatic health.
Good afternoon.
Welcome, Nishanth. How are you
Thank very
feeling?
much. I'm feeling slightly nervous, but yes, excited.
Don't be
for
nervous.
this.
It'll be all fine. We're really excited to hear your pitch. Please
you.
go ahead.
Sure. Oops. Hi, I'm Nishanth from EO South Asia, and I'm from IIT Kanpur, and I'm the co-founder at Nambikkai Rehabilitations. Nambikkai is a Tamil word for trust, and I'm on a vision to deliver trustworthy end-to-end knee rehabilitative solutions for elderly patients, irrespective of their economic status. Growing up, I was very close to my grandmother, and I saw her battle osteoarthritis for many, many years. And while I accompanied her to hospitals and multiple healthcare providers, I realized that doctors use MRI, X-ray, and other imaging scans to provide knee care, but it was based on their own subjective interpretation. Unlike a blood report, which is quantitative and black and white, people could not really figure out where they stand and used to be highly confused because of this subjective test. I also realized that if this was the status at India's biggest hospitals, what would be the case at rural India, where expensive instruments like MRI, being very bulky, cannot be accessible, thus denying them quality healthcare services. And this is not a niche problem, it's a household problem. In fact, 1 in 3 rural patients suffer from osteoarthritis, and this is only growing with even younger people suffering from this these days. And with this, Nambikkai was born with the vision to be the first player in the market to quantitatively measure knee health in a dynamic fashion. How are we doing this is, so this patented postage size stamp, we record the patient's exercises when a doctor does on it in all the 3 axes, like all 3 axes. And then using integrated on an application, we are able to provide quantitative and on-spot knee report card at the convenience of their phone and location. I was a big fan of Dr. Velumani sir, who's the founder at Thyrocare, which is like a $5 billion company today in India. Dr. Velumani realized the Indian context and delivered accurate yet high quality health thyroid tests for large masses, thus unlocking huge volumes and thus leveraging economies of scale. Similarly, I want to build leveraging my portable, affordable yet highly accurate device to rural parts of India, where quality healthcare can be given at the convenience of the mobile phone. So coming to numbers, we are using a B2B model where we will sell with our initial product at attractive low prices to our clinics, and every time the clinic performs a test on the patient, we will take a portion of it as a commission. And the primary sellers are doctors, rehab specialists for post-care, and sports clinics for preventive medication. And once we have established a strong presence in the market, and when we have a great traction, we will then enter the insurance segment where we are providing them quantitative insights. Because interacting with multiple insurances, we realize there is a strong interest to enter the rehabilitation space where currently reimbursement is not covered. So I'm Nishanth, a BTech at IIT Kanpur. In fact, I am supported by a very wonderful team, without which I think I wouldn't have reached so far. So we have Varun, who's the Chief Medical Officer from an MBBS college, and we have Jayant, who's the Technical Lead from IIT Madras. We are also supported by Dr. Selvan sir, who's the Director, Dr. Kannan sir, who is the Clinical Advisor and the co-founder of Spark, who we have currently tied up for our first sales partnership, who has 35 plus clinics in India, and Prof. Manivandan sir, who is the Technical Advisor for us. This is like our current progress, and this is our team and my journey. So, panelists, are you ready to join Nambikkai on our mission to democratize healthcare one joint at a time? Thank you.
Thank you.
Thank you. We have a bit of time for questions now.
Sure.
Maybe let me start first of all. You talked about your current stage. You went through that slide. Where are you exactly? What stage are you at the present moment?
Yes, sir. So we have got the patent rights, and now we are in the clinical trial phase. We have completed transforming patients of 200 plus patients, and now we are almost done with clinical trials, and we are entering the market now.
Thank you. Any questions?
May I ask a business question?
Sure, sir,
And
please.
how much it's gonna cost, and how much you are trying to sell?
Exactly, sir. So this is in fact, our moat, I would say, is that we are able to produce this at around 2,500 rupees, the one-time product, and we plan to sell it at as low as $99 or 8,000 rupees. So we have that attractive investment with us.
When you're dealing with rural patients, and I assume you've already interacted with potential patients or
Yes.
customers in the market, do you find that they're trusting this device that you have created? And
Yes,
how do you
ma'am.
deal with that taboo of
Exactly. So
technology?
when we go and approach them, it's hard for them to believe that undergraduate students are actually trying to build this, and then the trust issue comes in. But then, since this is actually a product and a paper of an IIT Madras professor, and which has been strongly supported by the clinical advisor, through them, and then we're saying that we have supported them, we've already published papers, and we have always got a patent. Then they start understanding the seriousness of the product, and then they start trusting us.
Yes. Nishanth, thank you.
Thank you.
What is your purpose?
Yes, ma'am. So my purpose, I would be fulfilled as an entrepreneur if I'm able to reach every single rural part of India, providing them quality healthcare, because that I feel is denied for majority of Indians at least.
Thank you.
Thank you. So, I mean, that's a great question. So building off of that, building off of your purpose, is this the only product?
Yes, sir. So we've designed our algorithms in such a way that right now this is our only product, but this can be easily extensible to other joints, starting with the knee and the elbow and the shoulder.
Perfect. That's what I wanted to hear.
Thank you.
Yes, Nishanth, congratulations.
Thank you, sir.
I got a surgery in my knee a few years ago, and I'm wondering if doctors could be like an obstacle for you, because for some of them, sometimes they need more the surgery than us. So how do you deal with those kinds of obstacles?
In fact, that was one of our strong pushbacks in the start, that the acceptance in the doctor community. But that's when we repositioned ourselves, saying that, okay, this will be an assistive help device similar to an MRI, where doctors are looking at this and then suggesting, surgeries, or then suggesting real rehabilitation, etc. That's how we plan to tackle it. We're not trying to fight the doctors in the market.
Thanks. You've sort of went through your team, pretty
Yes,
large team, right? And you've got some advice as well. How do you delegate the work? How do you sort of work together?
Yes, sir. So I have
What is
no
your role?
experience in clinical trials or electrical engineering, which is the fundamentals of this. So I trust my people, and then if they are good at it and they are passionate people who have joined me on my vision, I trust them and I entrust it. So how do I delegate work is we keep weekly stand-up meetings where we are saying, okay, these are the milestones for the next 3-4 days. These are the deliverables for me. These are the dependencies for you. And let's again group up after 2-3 days to see how we have progressed. That's how we primarily work on, setting small milestones so that we cover one at a time.
Any other questions?
Talk to me about your manufacturing. Are you controlling manufacturing? Are you working with partners? What is the plan?
No, ma'am. So we have our completed PCB, our printed circuit board, and we are using contract manufacturing because we believe for now we have not achieved the scale yet.
Right.
So for now, if we invest our time and focus on R&D on manufacturing, we may not be able to focus on R&D. So we're doing it as contract manufacturing.
Okay, thank you.
Praveen?
So, I mean, you touched on how the product works.
Yes.
I know we're focusing a lot on the product because we really want to make sure we're giving you a fair assessment. How long does it take? Like it's at the clinical trial, it's at they're putting it on you and
Yes.
they're testing you. How long does that take?
So, sir, there are very simple exercises. So the physiotherapy or the doctor, on any patient generally, they would do a Lachman test, which is like moving the upper leg and the lower leg. And then they'll do a slight torsional test. And then this will maximum take 3 to 4 minutes. So that much of a time, our products are very accurate, sir, up to a millimeter. So we are able to capture the data in that 2 to 3 minute testing zone. We're not trying to deviate away.
Thank you.
Thank you very much.
Thank you very much.
Thank you.
For this
best.
opportunity.
Thank you. Well done.